capture, reflect on, and share our lessons learned and observations from these types of operations. Operation Laser is no exception to that. And we have certainly learned a number of lessons from our operations inside of long-term care facilities, but also in other jurisdictions in support of Canadians. For example, specific to long-term care, to address your question, we learned quite a bit throughout this pandemic in terms of how to properly don, use, and doff or take off medical grade personal protective equipment. We've learned about some of the dynamics of mobilizing CAF health services personnel to support some of our vulnerable populations. We've learned how to collaborate with different agencies in different levels of government. And so what we've already done is we've taken those lessons, we've shared them throughout the force, and as we remain postured for additional potential requests for assistance, those troops will be going in, having benefited from the tough lessons learned by some of their teammates. I think the Surgeon General as well, he might want to amplify one of those points.
Yes, Madam Chair. So in addition to that, we're obviously following the science and the scientific community findings related to COVID. And we know a lot more now about COVID compared to what we knew in the spring. So obviously the mode of transmission, in what type of environment the transmission is more likely, and this will inform how we prepare our troops for potential additional tasks.
Thank you very much. I know Canadian Forces.
I'm afraid your time is up, Mr. Garrison.
Okay.
Yes.
Thank you.
Thank you. Mr. Bazan, please.
Thank you, Madam Chair, and I want to thank our witnesses for attending today, and I want to thank the great work that all of you have been doing on making sure that Canadians are all taken care of during this pandemic, and the role that all members of the Canadian Armed Forces have played in both force protection as well as protecting Canadians. Just want to follow up more on what Mr. Garrison was just saying, and about preparation and potential use of Canadian Armed Forces in the next go-around of this pandemic. I know, for example, the Mayor of Winnipeg, the Chief of Opaskwayak Cree Nation are making requests here in Manitoba for military assistance. Has any of that filtered up to Canadian Armed Forces levels yet? And whether or not you are prepared to go if required.
Madam Chair, thank you for the question. We are absolutely plugged in to the situation across the nation. We are working very closely with Public Safety, the Government Operations Center, and other government departments, Public Health Agency, Health, Indigenous Services Canada. In fact, the Canadian Armed Forces, along with some of our other federal government partners, spent most of the weekend talking about the situation in Manitoba and many other jurisdictions throughout the country. So we are quite in tune to the evolving situation. To answer your specific question about the province of Manitoba, we have engaged in interactions with some of our provincial partners to better understand what the requirements and needs are. And if a request for federal government assistance or Canadian Armed Forces assistance comes across, our Chief of Defence Staff will be prepared to provide advice to our minister, and if tasked, to dynamically task troops to help Canadians in their time of need.
Thank you. Now, one of the things that I've always been quite proud of is how Canadian Armed Forces started down the path of mental readiness. And during Afghanistan, we had the Road to Mental Readiness program. I was a little bit concerned when I read in the media last week that Major Carolyn Martin, who was working in the long-term care situation in Ontario, and she was testifying at commission, and she was talking about how devastated members of the Canadian Armed Forces were when they entered some of these facilities, the squalor, the miscare of residents and our loved ones. So I was wondering if there is being, again, R2R being provided to our troops for those that were in long-term care and are still somewhat devastated from what they experienced, as well as being prepared to go in again if needed.
Madam Chair, thank you for the question. I'm going to start answering this from a chain of command perspective, and then I'm going to hand it over to the Surgeon General to talk about specific medical supports that are being mobilized for our members. Certainly, we all recognize that Canadian Armed Forces members are often deployed into some very difficult environments overseas as part of some of our international operations, and from time to time here in Canada as well. It's why the military force of last resort is mobilized, and long-term care was particularly challenging because of course we are Canadians first and foremost, and we do not like to see fellow Canadians suffering, and so we deploy as a priority in support of those vulnerable Canadians. What I will say in terms of what we try to do proactively to mentally prepare Canadian Armed Forces members for these types of operations. First of all, we aim always in an all echelon to try to destigmatize mental illness, to make sure that Canadian Armed Forces members know that, first of all, and if they have challenges, they can raise those concerns with their chain of command. Leadership and cohesion factors into this significantly, and you've referred to the Road to Mental Readiness program that helps to better visualize that environment to ensure that arousal control and different techniques are put into place for CAF members when they operate in those environments. I'll hand it over now to our Surgeon General to talk about some of the medical specific supports and psychosocial supports that are available to CAF members.
Yes, thank you, Madam Chair, for the question. So obviously, prevention is key in mental health, and when exposed to challenging situations like the long-term care facility, this was a critical aspect of preparation of our troops. And the Road to Mental Readiness program, that is an existing program for many years, has been tailored to the specific needs of those troops going in long-term care facilities. So we were able to make sure that specific environment was captured, and therefore having a customized preparation of our troops. During the deployment itself, we had social workers that were deployed and made available on a 24/7 basis for all of our members who were deployed in the long-term care facilities. The units also deployed chaplains that are part of the support team, if you will, and help addressing some of the challenges that our members could have been facing. Obviously, our 24/7 telephone support were still available for our members during that time, as well as our peer support program, the OSIS program. And we were able to basically provide the care and the support that those members needed during the mission. Post-mission, we put in place another Road to Mental Readiness program to basically close the loop from the prevention prior to the mission. And then we also instituted a post-deployment screening process by which we'll be able to identify any members who might not have been captured during the deployment or immediately after, and usually do that 3 to 6 months after the deployment. So this is part of our ongoing approach to basically screen early and identify early members who may be suffering from mental health challenges. And in addition to that, we're conducting a research study trying to identify the challenges that our members are going through and have been through, with the aim of trying to learn how we can better prepare them for future missions similar to this one.
Would that study include both those that have been deployed in op laser and those that have been pretty much confined to quarters because of force protection measures taken by the Chief of Defense Staff?
Yes, Madam Chair. So like any good study, we're trying to build a control group that will be basically allowing us to compare how that environment was more challenging than another one and trying to identify if there's specific trends related to that environment.
Okay. All right. Thank you very much. Mr. Spengman.
Madam Chair, thank you very much. And I'd like to start by thanking our witnesses, our team of senior Canadian Forces officers, for being with us today and for their distinguished service. And through them, also thank the women and men in uniform who are serving alongside them, with particular gratitude for the work the Canadian Forces are doing in helping us get through the pandemic. I'd like to start with a question to take us back to some earlier discussion on training, and perhaps start with Major General Cadieux. To what extent is pandemic response training part of the Canadian Forces training package at the moment, maybe from the very basic first steps, basic training, up to more advanced training and senior ranks? And to the extent that there are gaps, what would be your vision in terms of strengthening that training?
Madam Chair, thank you for the question. The Canadian Armed Forces, of course, our role, our mission is to defend Canada and Canadians against all threats. And so as our Canadian Armed Forces members progress through their training, they need to be prepared for up to and including general purpose combat operations, which generally speaking from a military perspective, that covers an entire spectrum of activities that they might be called upon to do. And in the course of that training, they will be exposed to and they will receive tools that can be applied in a domestic setting or paradigm, such as what we have seen for Operation Laser, the Canadian Armed Forces response to the COVID-19 situation. For example, when our Canadian Armed Forces members deploy on operations abroad, they have to deal with local populations, with other government agencies and departments and partners. They are often called upon to deliver humanitarian aid and assistance, provide logistics and transportation support. And so as part of that general purpose combat training that they receive a suite of tools that can be applied for activities such as this.
Thank you very much for that. Looking at the deployability of Canadian forces in the context of a perhaps continuing pandemic for the longer term, is there any guidance that's coming our way from NATO and the UN with respect to deployments, peace operations? And to the extent that this is still at the beginning, is there room for Canada and specifically the Canadian forces to input into such frameworks?
Madam Chair, thank you very much for the question. Of course, as you indicate, globally, we are all learning as we go through this pandemic together how it's going to evolve and what the potential implications to our allies and partnerships might be. What I will say that with strength, once again, after initially contracting the force to privilege support to Canadians, which remains in place, we have been able to resume almost all of our operations in support of our allies, including NATO and the United Nations deployed abroad. So we have approximately 2,000 Canadian Armed Forces members deployed on approximately 20 missions around the globe. Activities and operations that are going to be contemplated specific to the pandemic, we will continue to watch for those. And if there's an opportunity for the Canadian Armed Forces to be engaged, our Chief of Defense Staff will provide advice to our